What is anemia? Well, the word anemia comes from two Greek roots when combined together means without blood. But to be without blood would be an overstatement. Anemia is a state in which there are insufficient numbers of functioning red blood cells or lack of hemoglobin to meet the demands of the tissues for oxygen. Our red blood cells begin their life in our red bone marrow as erythroblasts. They then go through maturation, where they then become filled with hemoglobin, lose their nuclei, and become a biconcave disc carrying hemoglobin to our body's tissues. Our red blood cells have an average lifespan of 120 days, so our bone marrow is constantly busy making new cells to maintain balance. When the balance of producing new red blood cells and disposing of old red blood cells is disturbed or interferes with the maturation of cells, anemia occurs. There are three major classifications of anemia according to cause: anemia resulting from blood loss, anemia resulting from a failure in blood cell production, and anemia associated with an excessive destruction of red blood cells. Anemia resulting from blood loss is caused by rapid severe bleeding, hypovolemia, which is a decreased volume of circulating blood, and potentially shock. Bleeding can result from severe trauma to blood vessels and massive hemorrhage, or more gradually from a small peptic ulcer bleed, which leads to chronic blood loss. The amount of blood loss that leads to hypovolemic shock can vary depending on a person's body to compensate for lost fluid volume. A blood loss of 500 mL in an adult with normal circulating volume can cause hypovolemic shock. Some signs and symptoms you can watch for is a falling blood pressure, rapid weak pulse, cool damp skin, thirst, decreased urine output, and restlessness, progressing to decreased consciousness. Anemia, resulting from a failure in cell production, can be caused by either a deficiency of certain substances necessary for the formation of red blood cells or abnormal function of bone marrow. Examples of these would be nutritional anemia, which there is an inadequate intake of foods containing proteins, folic acid, and iron. Anemia resulting from bone marrow suppression caused by toxic substances, and pernicious anemia, where certain nutrients are not absorbed well, such as vitamin B12. Hemolytic anemias, in which red blood cells are destroyed prematurely in the body, have many causes. Some of those causes can be a result of genetic defects that affect cell structure, inherited, such as thalassemia, or acquired when erythrocytes are exposed to poisonous agents such as chemicals or bacterial toxins. Immune reactions can also cause destructions of red blood cells. Toxins, infections such as malaria, transfusion reactions, and change in blood chemistry can cause cell hemolysis. Iron deficiency anemia occurs when the total body iron is insufficient and erythropoiesis is diminished. The lack of iron impedes the formation of hemoglobin. In pernicious anemia, an autoimmune disease, the intrinsic factor is missing from the gastric juices, and vitamin B12 is not absorbed without it. Vitamin B12 acts as a coenzyme in conjunction with folate metabolism, and it is important in utilization of iron and protein for manufacture of red blood cells. The resulting factor is that the red blood cell production is decreased, and the cells that are produced are abnormal in structure and function. Hemolytic anemias associated with excessive destruction of red blood cells are quite rare. When red cells are not normal, they break up easily and are destroyed by the body more quickly than our normal red cells. This RBC destruction causes anemia. Anemia occurs during end-stage renal disease when there is deficiency of production of erythropoietin, a substance necessary to stimulate the creation of red blood cells, in the bone marrow. Signs and symptoms of anemia from causes other than rapid bleeding depend on whether the anemia is mild, moderate, or severe. Signs and symptoms of mild anemia, which is a hemoglobin level of 9.5 to 13, are mild headache, palpitations, and dyspnea on exertion. Moderate anemia, hemoglobin 6 to 10, may include brittle nails, sore tongue, pallor, chronic fatigue, headache, and dizziness or faintness. Some signs and symptoms of severe anemia are tachycardia, weight loss, yellowing or pale conjunctiva, jaundice, bone pain, impaired thinking, irritability, depression, or fatigue. For diagnosis, the microscopic appearance of the red cells in a film of blood that has been spread over a slide gives information about abnormalities in size, shape, and color of erythrocytes circulating in the patient's bloodstream. The CBC and differential cell counts results are used to diagnose the presence of anemia. Measuring the quality of hemoglobin determines whether the cells have sufficient amount of hemoglobin to carry adequate oxygen to the body. A normocytic normochromic anemia is characterized by cells that are normal in size and color, but that have a deficiency in the number of red blood cells and a low hematocrit. This type of anemia is usually a result of sudden blood loss. Hypochromic microcytic anemia is characterized by a decreased level of hemoglobin in small cells. This type of anemia is typically an iron deficiency anemia. For treatment, correcting the underlying problem and then building up replacement blood cells treat anemia for chronic slow blood loss. Anemia caused by inadequate iron, folic acid, or protein intake is managed with oral iron supplements, vitamins, and diet adjustment. If the anemia is serious, blood transfusions may be given or iron supplementation may be administered intravenously with iron dextrin, sodium ferrous gluconate, or iron sucrose. Pernicious anemia is treated by regular injections of vitamin B12 or weekly use of intranasal form of cyanocobalamin. Because of the deficiency, the intrinsic factor prevents adequate absorption of this vitamin from food. There must be sufficient folic acid in the diet or by supplement. For hemolytic anemia, the underlying cause is found and corrected if possible, and then the blood volume is rebuilt with added iron and appropriate diet. If the anemia is severe, blood transfusion may be indicated. Some nursing interventions would be monitor for bleeding and hemoglobin and hemocratic levels, the signs and symptoms that we just discussed about anemia. You'll want to educate them on how to take their medication. For instance, if they take iron, they'll want to take it on an empty stomach to increase absorption, or with a small meal if they have any GI upset. You can also encourage them to take it with vitamin C, such as orange juice, because this helps with absorption of iron. They'll also want to avoid taking iron with milk, calcium, and antacids because these decrease absorption. And if they do need to take any of these, they'll want to wait about 2 hours in between before or after administration. You want to educate them about dark stools that they'll have. That's normal unless they're black tarry stools and have streaks of blood, then these are not normal and they need to be reported to the healthcare provider. And you'll also want to teach them about how to have a good diet to help maintain their anemia.